Hello there, we're live from our studios here in Koko Mlimle on digital address GA0992539. It's your home of fearless, credible and independent journalism. Our lead stories this hour. COVID-19 statistics rising gradually here in Ghana, even as Health Ministry insists the deadly Indian strain which has been recorded has not reached the communities yet. We have an ICU team leader from the USA one of the countries hardest hit by COVID as we look at the implications of the new strain here in Ghana. Your questions are welcome. Hopelessness pushing a lot of teenagers to contemplate suicide. A survey findings by Childwise International suggest perceived bleak future is pushing 55% of our children to consider leaving Ghana for better lives elsewhere. Also, we'll talk about how Ghana is to pay a $170 million judgment debt rather than negotiate an $11 million settlement after it abrogated a power deal contract. We hear from the country's Attorney General, who insists criminal investigations must begin, and also get an explanation from former power authorities. The Pulse is brought to you by Global Communities Dignilu Affordable Safe Sanitation. Join us on DSTV 421, Gold TV 144. Remember, we're streaming live on YouTube and our other social media handles. And today, we want to get interactive as we do always. Any questions you have about COVID-19, keep them coming. My name is Gifty Andopia. This is The Pulse. Please be my guest. Welcome to the show. Younger people in the Ashanti region capital, Kumasi, are getting infected with COVID-19. That's the latest information according to health experts in the region. Dr. John Amoisi of the Kumasi Center for Collaborative Research, who reviewed this, said the numbers are higher, particularly in the Ashanti region. He's warning the country will be badly exposed if the new variant is detected in the general population. He wants the Ghana Health Service to strictly enforce testing and quarantine of those that test positive.
I really want to make it clear that the manifestation of the third wave is very critical. In the UK, one could argue that they are actually in another wave of sorts, albeit maybe a fourth wave. But what's happening is that it's not going to impact on the hospitalization rates and the death rates. It's the infection rates. So what does it mean for us here if we are in a third wave? For me, it means that the risk of severe disease and ultimately hospitalization and death might be high. If you look at the numbers in the Ashanti region, it's already going up. We're doing some work, right, for which we need to do some pre-screening. And I can tell you that over the past 2 weeks, we've seen a significant rise in the numbers of positives that we're seeing. We did a pre-screening and half of those we pre-screened were positive. All right. It's really interesting. And I actually told my team that just wait till next week. And it's exactly happening as I had predicted, because, you know, the science doesn't lie. It's just like, you know, it's just what it is. It will happen. All right. And it is happening. So what this means is we need to be really careful. And if you watch carefully, it's exactly the same picture. It's the younger population. It's the younger population. Because of where I sit, I get many calls from people. Oh, I'm not feeling too well, so and so and so. So you send them for testing, you find that it's positive. And then you just have to make sure that they're isolated and so on. So
that's Dr. Amoisi there speaking last night with my colleague Evans Mensah, revealing the statistics in Kumasi, in the Ashanti region. And that's where I'm taking you right now. We've got Dr. Michael Roxin-Ejay. He's a Deputy Ashanti Regional Health Director. Doc, thank you very much for your time. I understand you have a very busy schedule, but let's try and get a bit of an understanding. Has this new information about the rising numbers in your region come to your attention? I believe it has.
And thank you for having me. Yes, there is something we are fully aware of from the week 23 of this year. That is last 3 weeks up to date. We are fully aware of what is happening with respect to the number of cases we are seeing per week.
So the number of cases you're seeing per week, I suppose, is rising. Can you share with us a bit more of the statistics? What do the numbers look like?
Okay, let me take you a little bit back for us to understand the trend. After Christmas, that's when we started this year, the average number of cases we were seeing per week was around 300, 350. And then at the end of February, beginning of March to the middle of March, we started seeing a decreasing trend that the case suddenly fell to 20 per week. And that had been the trend for the last 3 weeks when we started seeing an average of 35 cases per week. So obviously we are having almost doubling of the trend we've observed for the past 8 weeks or so.
It actually looks much more like than doubling, because if we had 350, if I got you right, is that 350 per week?
Yes, that is with regards to January to February, and then we came to 20 per week.
Yeah.
So this doubling is with reference to the baseline, the new baseline we set after coming down from 350 to 20, had been 20 for about 8 weeks before the last 3 weeks. That's what I'm saying.
Okay.
It is doubling.
Okay. So from the 20 per week, which was at the time that the numbers were going down, we are where at this moment?
Now we are doing 35 cases per week averagely.
Okay.
And if I have to go into the detail, when this spike started, that's last 3 weeks, we recorded 39 cases, and then last 2 weeks we had 37, and then last week we had 43. So if you strike the average, we are almost around the figure I'm talking about.
Right, and this should certainly be a sort of concern to you. Do you know what is accounting for this?
Obviously, we are very much concerned because when we came to a new baseline, so to speak, of 20 cases per week, yes, we were very happy because people were adhering to protocols. We were all together as one. But prior to this surge, we saw certain change in regards to people's attitude towards the protocol. We were not regarding, we disregarded nose mask usage. And for example, we did a casual survey at KJTR, a Doom area, and we found less than 3 people per 10 wearing face masks correctly. Okay. So we knew that this event will come up one day, and we intensified education. But there's a difference between educating the people and they adhering to it. So that has accounted for where we are now.
We are glad to hear from the health service, Ghana Health Service, that although we have recorded the Indian strain, it hasn't gotten to the community yet. But then we've been speaking to some of the people in your region. Doc, if you just give me a few minutes, we'll just hear them and then we come and wrap up with you. I understand you have to go for a meeting, but let's hear what people in Kumasi think about this new development.
There's nothing I'm doing about the safety protocols. Me, for instance, the way the media were preaching about this coronavirus pandemic, nowadays I've not been hearing it. So me, I think it is gone for good, and there's no way to come back. I heard the Ashanti region, we are leading. When you see our attitude, the attitude of the people in the Ashanti region is very bad. Though it is not gone it is not gone. But the way, especially when you sit in the trotro and the taxi, people are not wearing their nose masks.
The Ashanti region, we are having a problem because of the political interference of the district. Because recently, when the St. John burial, and then a lot of people are making a lot of comments that if the president will be making all the necessary about to wear the face mask and all this thing, and then they themselves during the funeral, there is a lot of things happen there. And then because of that, a lot of people, then you can't be communicate to some people who are not wearing it. Because when you try to let them to use what you are doing, they are trying to refer you to the politician.
Coronavirus, me say them say, in said that you say coronavirus be never hand. Because here abrofun, on the coronavirus start to fear by you. You don't see amubu. When you pay good stadium, you get the ye. Now here to Ghana the coronavirus be concluded. I mean they say, and when you phone discadi, oh abrofun hono sala mi hunu pa. Because here. We are not adhering to the protocols because we are tired of them. Every day there's new virus. Every day there's new virus. We don't know what to do again. We are tired of them. They should come and kill all of us. We are tired of them.
And that's the typical behavior that you find on the streets. I mean, not just in Kumasi. You find this here in Accra. You find this. I've been to the to Bolga about last 2 months. You hardly find people wearing the mask. You are concerned, but you said that the health authorities in the region have been sensitizing the people. It looks like it hasn't really worked, has it?
Yes, you can say that because if it had, we would find a lot of them adhering to the protocol, but that does not actually break our effort or make us feel unrewarded. We are still up because that is one of the ways to ensure. Let me add that the protocols are the first line in preventing infection. So for me, I'll go much of the protocol than even talk of the vaccine. The vaccine is a second line, and we know the global strategy. So the only arsenal we have in our hand to beat COVID-19 is observing the protocols, and that is very cheap to do. Everybody knows what to do. So if we do that, we prevent exposure in the first place, and also prevent people from getting infected. No matter the type of strain that comes up, the protocols can stand the test of time. For mutation of the virus, the Delta variant is not going to be the last. We're going to have several of them because that's typical of viruses. They keep on changing and they get more lethal and lethal as they mutate. But like I said, the protocol will surely stand. So we are not relenting. And we'll go on to do what we have to do as public health physicians. And we'll also employ the security agencies to also enforce, or government to enforce the laws on these protocols. And I believe that when enforcement is done together, we can bring down this spike that we are seeing.
Interesting. Let me just wrap up by asking you, the Ghana Health Service says we don't have, the new variant traveling to the communities yet. As far as we're concerned, it looks like it was detected at the airport and has remained at the airport. Should we, just in case, have this in our communities? To what extent do you think the Ashanti region is ready infrastructure-wise, personnel-wise, to deal with an outbreak again?
We've never gone out of the pandemic. We've always been in it. So we've not let down our guards. Our systems are well in place. So we've never for once thought that, it's over, so let's pack our tent and move. We are always ready to deal with the aftermath of any variant that may enter our communities. But let me also emphasize again, we have to adhere to the protocols. I heard the young people, the young men, or the people you interviewed, talking about being tired and so on and so forth. I share their concern, but we're able to take out this pandemic. We can't get tired. If you get tired, it means that you want to die.
I like the way you end it. I think that should be okay to leave the conversation here. If you want to die, then you don't observe the protocols. Doc, thank you so much for taking time off your busy schedule this afternoon. Dr. Michael Ajay is Deputy Ashanti Regional Health Director there. And we went to Kumasi because we're hearing there that many more young people are getting infected. And the numbers are going up, by the way. Well, over 90% of the population have yet to even get the first dose of the vaccination. And this, the Food and Drugs Authority finds worrying. Chief of the authorities' Joint Committee on Vaccine Safety, Professor John Japon, says a third wave may not be good for the country. He spoke earlier on the AM show.
We need to alert our public health system to ensure that the protocols are maintained. Because it is the same thing, whether it is Delta, Gamma, Beta, or Alpha. It is nothing else that we can do except to ensure that the protocols are enforced. Okay. And I want to emphasize this because even in a country where less than 2% of our population have been vaccinated, that is our best bet. In fact, that is our only bet that we have. You know, in the UK and other places where they have vaccinated a much, much bigger percentage of their population, the force of infection is much lower. And even that place, they are having challenges with the Delta strain. So can you imagine what would happen if the Delta strain were to get into our community and begin to spread? It will spread like wildfire. So we need to, reinforce our surveillance system, particularly at the airport, and then also at the community level to ensure that if there are any cases that have come into the community, we use our surveillance system to identify and put in place the appropriate public health measures to avert any wild spread.
Welcome back to the show. Many thanks for staying with us. Like I said, today we're taking your questions and we want to delve a bit deeper into this new strain and our COVID protocols, anything COVID-19. So we'll have a bit of an extensive conversation. I have here in the studio with me Dr. Samuel Kojo Amakohene. He's an anesthesiologist. How did I get that wrong? Anesthesiologist, a COVID-19 ICU team leader at ECHN Health Network in Connecticut. He's a co-founder and president of Global Partnerships Halodyne LLC. Doc, you're welcome to the show and thank you very much for your time.
Thanks for having me, Gifty.
Okay, so we've been seeing you talk a lot about COVID on Newsfile. Right. Today we have you here. We want to get interactive and ask our viewers to get in touch with us with their questions and their thoughts on their mind. I just want to, you've been in Ghana since when?
I've been in Ghana since the 10th of this month.
Oh, this month.
Yeah.
So walk me through the experience, from the airport all the way into the country, comparing to what you have back there in the U.S., which is, of course, one of the countries hardest hit by COVID-19.
I think coming in for the first time since the COVID outbreak, I really wasn't sure what to expect. Okay. Obviously, in the U.S. right now, most places people don't wear the mask, except when you go into stores. So I was kind of like looking forward to what the preaching has been specifically to Ghana and what we're doing. At the airports, you really observe people, most of the people wearing masks. Mm-hmm. Social distancing is another thing to talk about. But generally, people were trying to observe the protocols by trying to wear the mask and sanitizing, and you saw the hand sanitizers everywhere. So those were very encouraging. And then obviously, once you transition from the airport into the city, it's a different ballgame.
It's a different ballgame, isn't it?
Yeah.
Okay, so let's look at the new strain. Mm-hmm. You talk about, and I wanted you to take us through what you saw at the airport so we can try to have a context to the conversation of how this new strain got in. Maybe we won't be able to have all the answers now. We've seen the health ministry, issue a statement today in which they say, yes, there has been, I think, about 6 confirmed at the airport, but it's not gone to the community yet. I'll take your thought on that. But if we were to assess what is happening in India and imagine that we have a strain of that here in Ghana, what will be your thought from a public health perspective? Immediately, what comes to mind? And to what extent is Ghana exposed to what risk?
Well, that's it. That's a great question, a loaded question.
It is indeed
I think when you have to sort of step away from everything else that's happening. And for Ghana specifically, our first defense is at the airports. And I think it's a great thing that the country is able to do aggressive testing, very sensitive antigen testing, which is going to pick up about 90% of the positive cases that you have.
Okay.
Obviously, that's not 100%.
Yeah.
And so whatever positives you pick up, one can safely assume that there may be one or two or few cases that you may not be able to pick up. If I just say I'm on a flight, I got tested, and at the airport I get tested again. But on the flight, I picked up a viral particles, right? You may not be able to see it because my body I've not fully infected yet. So I'll be allowed to go home.
Yeah.
And then obviously once I get into the community, albeit that I've been told I'm negative, now I'm going to be able to pass it on. So it's good that we're doing aggressive testing at the airports, but it's also important to recognize that the moment you begin to see them or pick them up at the airports, you have to then step up your preparation. Genomic sequencing and aggressive testing, even within the community, because you more than likely have some of that Delta strain within your community. You just don't know it yet.
You just don't know it yet because you say that the protocols you find at the airport are encouraging, but 90% could be detected. So that 10% is still most likely in the community.
You may have that. I mean, we dealt with the same situation in the U.S. at the beginning of the pandemic when we would assume that the virus is coming from Europe, and we're like, oh, we're picking them up at the airport. Certain number of those strains were in the community, and then sooner or later we found out that we actually had more. We just were not aggressive for that testing.
Okay.
And so if there's anything that the pandemic has taught us is that you always have to be at the forefront. You have to be really proactive in being able to detect what kind of particular strain you may have within your border. So those are some of the things to really sort of hone in on and really be aggressive. But assuming that you've only picked a couple cases up and it's totally isolated to the people coming into the country, I think looking beyond that is the key, being really proactive.
Talking about looking beyond that, what should, from your perspective, we be looking at as a country, immediate, short, long term? You've talked about aggressive testing. Should this be aggressive testing that is focused on the community, or should we just now make the protocols at the airport even more stricter, or both?
I think you have to, like you say, you have to take it up into what are you doing right now? Right now, the best thing you can do is really keep up with what you're doing at the airports, but also in the communities, be willing to continue with your genomic sequencing to really know, as you are testing people and you're sort of able to isolate randomly, find out how many of these positive cases you're having, especially when you take Kumasi, for example, in the Ashanti region, of these cases that are turning positive, how many of them are you detecting to be the Delta variant, which we will talk about, right? So those are some of the immediate things at the airport. In the short term, those are some of the things you want to sort of look at. The third term goal will be to really make sure that when you do get hit with a third wave, whether it's a large scale or medium scale or small scale, do you have the ancillary support to be able to treat these patients? I'll give you an example. In Russia, where they have the Sputnik V vaccine, they find their ICUs flooded with patients with the Delta variant. And it is reported that these doctors are trying the best they could to treat patients, except that the treatment that we've used with the first and second wave isn't working. So if you're Ghana, you have to ask yourself, if people are failing out there with a lot more resources, what do I need to get in place? You're making sure you have your healthcare personnel, like your ventilator, your ICU capacity, and really being able to pick up people as soon as you can. So you don't let people come to you, you want to pick them up early enough so that they don't deteriorate so quickly, because COVID patients can go very quickly.
And COVID patients could go very quickly, but we're also seeing that the strain in India is very, very different. Yesterday, we spoke to the head of Noguchi, who said that antigen testing is very good, that we ought to step up with our antigen testing, and you have mentioned aggressive testing. I don't know the extent to which wearing the mask and observing the protocols actually step in when we're dealing with what happened in, the Indian strain. I don't know the extent to which it's effective, but the head of the Noguchi said it looks like in the immediate term, that is the best solution. But do you get the sense that people actually understand? Or how else can government make people, or health authorities make people get the message? I mean, I don't know how it was done in the US. Maybe you can run us through the way it was done there. But do you get the sense that people actually understand, or are the authorities really communicating what, from a public health perspective, they should?
I think when you take the US, for example, when COVID hit, it was clear that there was a problem on our hands. And so the news media never really gave up. And that sort of tension was always there. People knew what was happening, whether you wear the mask or you don't. It was being honed in every day. Certain measures from the government level was basically put in place to sort of incentivize people in really sticking to the protocol and try to engage in behaviors that were not going to put the whole country at large in a deep trouble. Now, those were the things we did. You still could not force people to wear the mask. You still couldn't force people to observe the protocol.
Yeah.
I mean, that's a challenge that any nation, in all honesty, is going to face. And that's the reality of the situation. Yeah. But I think what we in Ghana can do really is to ensure that we are adhering to the protocols. And how does that happen? When you have a situation in the Ashanti region, for example, where people think that the media or the government or we as in the healthcare community are not really speaking enough about the infection that is happening, the third wave that we are really concerned about. If that's not being talked about really well, then you're gonna have the people thinking, oh, coronavirus came and it went. Everything is fine. So that message we have to be at the forefront. We need to really continue to tell people that this is a real disease, and that with the third wave literally right here with us, we need to be very careful in how we go about and in how we observe the protocols. Those are some of the things that we can do. As far as ensuring that what do we do when we really get large number of it in our communities, I think it really comes down to our preparation, making sure that we can take people and isolate them as quickly as we can, diagnose them and treat them.
Okay, so I want you to send in your questions. If you have any questions on your mind, do send it to us on 0540109009. That's 0540109009. Let's hear from you. What are your thoughts? We'll still be expanding this conversation. Doctor, I want us to talk about the vaccines. There have been concerns that AstraZeneca and Sputnik V are not as effective against this Indian strain. This morning, the notice or the statement we got from the health service says AstraZeneca is effective. I'm sure you've heard about this as well. What's your take?
So there's a lot in the media right now, right? When we started with the vaccines, we in the scientific community always talk about clinical trials. So when I sit at the table, I'm able to definitively say that a certain vaccine is 100% effective, 80% effective, 90% effective. Okay, take Moderna, Pfizer, AstraZeneca, Johnson & Johnson. These went through clinical trials. At this moment, we don't have any clinical trials to really say that definitively a certain type of vaccine is effective against the Delta strain. What we have is clinical judgment. So, for example, in the papers, in the news, in the scientific journals, there's been a lot of talk. In the UK, for example, there's a talk about the Public Health of England essentially did put out a notice basically saying that AstraZeneca appears to be effective, right? But you don't have
against which one? Against
the Delta variant.
The Delta variant.
Against the Delta variant, because they've been able to do sort of studies on these, but not clinical trials. So you're looking at the population in general. You're looking at how many of them are coming in with the new variant. How many of them are getting admitted with the new variant? How many of them are turning positive with the new variant? And you're asking yourself, of these patients getting sick, how many of them had the AstraZeneca vaccine? And you're deducing from that, right? So you see some positive news. It's not definitive. So I'll probably stay away from definitive, but I would say that there are promising signs that it may be effective.
Okay.
To what percentage is not, the jury is still out there.
I just want you to listen to head of the West Africa Center of Cell Biology and Infectious Pathogens at the University of Ghana, Professor Gordon Awandere. He has been speaking to my colleague Daniel Dazi. And Doc, I want you to listen to his concerns about this new strain. Listen.
Now we have to be looking at the right vaccines. We all this while we've been, fixed on, AstraZeneca and Sputnik V. We have to start shifting towards looking for, more of Pfizer and others, which have a better chance of protecting against these variants, because the future is these aggressive variants. That's where we are going. The UK strain would probably recede soon. It will be replaced by some of these new variants.
With the nature of the virus as we know it, there are new variants coming out every few months. So does that mean that we are going to have to vaccinate ourselves again when, there's another strain in the system that is different from what Johnson & Johnson and Pfizer can fight?
Yes, that's the reality, that this may be similar to the flu, that every year or every few years we have to adjust the vaccine to suit the prevailing strains. And so that's why local manufacturing and vaccine development is important. We need to start making serious progress.
So that's Professor Awandere there. Those are his thoughts that he shared. What do you think?
I totally agree with him. We know that viruses mutate. That basically, simple terms, means they change their genetic makeup. And for example, when you take the Delta variant, one of the things that we've learned is that it's changing rapidly. It's very contagious. And it may be finding ways to evade the vaccines that we have. And so it's clear that this is where we're heading. What's important is that we need to really begin to think about how do we get ahead of it. It's not that you're going to be able to completely eliminate it, but you have to learn to live with it, which is, for example, if Ghana is able to join an alliance where we're able to locally produce or assemble vaccines and be able to use it on our people and also deliver or send out some outside within the sub-region, that will be a critical piece of us being a leader and also being really able to care for our people. And so I totally agree with him. I think it's the new way forward, and we cannot sit back. We have to continue to look elsewhere and how we can stay ahead of it.
So speaking of which, local production, the government has been talking a lot about this. Yesterday we heard that we're starting clinical trials and that they're already engaging some volunteers. I don't know if you're aware about this. Are you aware?
I'm not entirely aware of the clinical trials being started here in Ghana, picking up some volunteers. That I'm not aware. What I am aware of is the fact that government has already put out its intention to really try to basically set up a local manufacturing plant where we're going to be able to do this. Now I know that's in the early stages. As far as clinical trials in Ghana, that I'm not aware.
Okay, so let me take your thoughts. So you are well versed in this area as well. Should we be going through this process? And I've spoken to Professor Dodu, who heads our standards authority, who is actually that's his area. Vaccines are his area, and he's indicated that Ghana has a reputation for sort of deflecting these proposals for clinical trials because people go out and say they're using us as guinea pigs, etc. If we were to actually be involved in vaccine production, what are the things you think we should have, the homework we should have done as a country to get it going smoothly and the way we expect of it?
So that really comes down to these vaccines have already been made, right? So for what Ghana is going to be doing is to basically get the patent, get the authorization, and teaming up, for example, Johnson & Johnson, which will allow Ghana to then be able to produce vaccines in Ghana and for the sub-region for that matter. It's not that we're entirely starting a new vaccine that now we have to go through clinical trials. When you live in the West, life is quite different. Some of us, my colleagues, we all volunteer to be part of the clinical trials, because this is what we do. And yeah, there may be some side effects, but we also see the significance of partaking in such events. So I think from that perspective, it's a good thing that government is trying to do that. Now, if you were to talk about a situation where Ghana has found a way in the technology to develop a whole new vaccine, then the thing that we need to do as a people, or government needs to do, will be that we really educate our folks and let them know that what we're doing is really a higher standard to achieve, and we're setting a higher standard for us and for the sub-region for that matter, ensuring that people will be protected. For example, in the US, if you get enrolled in any kind of clinical trials, guess what, Gifty? You're forever protected. In terms of if you were to get sick, if there were any side effects, you are protected. You know, your medical bills, all of it is going to be protected. So that gives me the assurance and you the assurance that if I were to partake in such an event, I'm not risking my life for nothing. And if there's a good outcome, your name will be part of it. And that's something that we probably need to, as a nation, cultivate within us, that it's okay to sacrifice. That's something that, you know, people in the West do a lot. They will sacrifice for the greater good. And I think we can adopt some of that.
Okay, we'll see how it goes. Let's talk about a third wave expected in Ghana as we perhaps wrap up on this. But I've been getting a lot of questions about the vaccines, and I think we've answered a few. I mean, I think we've basically answered that question about the extent to which the vaccine can protect you. I think you've talked about it. I still see a few here. Let's see before we go to preparations for a third wave, so to speak. Thomas is texting from Nalerugu. He says the World Bank and AU are collaborating to fund the affected African countries by subsidizing the vaccines. What is Ghana's take on that? I'm not quite sure what this answer, this question is. I don't know, Doc, if you are. I'm not quite sure. Does it make sense to you?
So I think probably what he's trying to get to is that the U.S. government, I think the past couple of days, put out a statement basically saying that they are now going to really release some vaccines for the global community, those in need, right? I think that's basically what he's getting at, which is a great thing for us, for people like countries like Ghana or developing countries, because as you know, India was producing majority of their AstraZeneca vaccines. Well, they got hit, so then they had to divert it. So COVAX, which most of these countries depend on, have not been able to deliver as everybody expected, right? So that's why, you know, as a nation, we need to be more proactive and look for other alternatives in really ensuring that we're not just looking at one approach, so that if Gifty and I are not able to deliver, at least we can go to that person C to really help us out. But I think that's what he's alluding to.
And that actually brings me to the point, a conversation we've had in Ghana the past few weeks about procuring of vaccines, where Ghana was procuring vaccines through third parties because according to our authorities, we were unable to reach a government-to-government sort of engagement or government-to-government agreement between the Ghanaian and the Russian government. You must have heard about it. What's your take?
I think there's a lot of chatter about vaccine procurement and things like that, specifically the middleman usage. And I've said that I don't really like the term middleman usage because it creates a negative connotation. What we need
but what else it is? It's a middleman, because this person is not the producer of the vaccine.
It is. So here's how I put it.
Okay.
I don't like to use middlemen. I like to use the third parties who allow you to purchase these vaccines that you need for your people. When you take the United States and the UK and all these developed countries, they donated billions of dollars to be able to allow them to have a seat at the table. Then they set up agencies. Okay. So the US doesn't have to go through anyone, you or me. But any other country now has to find a way to get to Johnson & Johnson, AstraZeneca, Sputnik V vaccine, right? So the players that went in and donated and gave money, they now own these sort of vaccines and they have the power. Okay. So you just need to talk to the right team to be able to find you a seat at a table when you don't have the millions to be able to sort of make decisions. So it's a myth, the way I put it, in terms of the usage of middlemen and the effect that it's sort of playing in the media. I think third-party usage is a better term to use.
Okay. And so it sounds to me from the way you're describing this as something that's not so far-fetched, something that's pretty usual or typical in the way that things work.
Absolutely. I mean, I took the time to engaging with my colleagues in North America and in Europe. This is what they do. For example, Johnson & Johnson will not they don't go out selling vaccines through ordinary people. They have agents. Right? So you have to go through one of those agents to be able to procure what you need. And so it's a normal process. I think once it's transparent and it's clear and you tell the people what you're doing, where you're heading, the obstacles you've had and how you're overcoming them, I think you really put a lot of these things to rest. Okay, well, transparency is one of the things that the people who discuss this matter called for. I'll just read a few of your messages and we'll move on. This one says, it's not only the people in the market. This person is actually texting from Kumasi. It's not only the people in the market, cars and other public gatherings who do not wear masks. Students in schools have equally not been wearing masks. Ibn Malik, you sent this message from Kumasi. Thank you very much. This one is asking, will there be the need for a person who has taken the double shot of AstraZeneca vaccine to take a third booster shot of, say, Pfizer to help prevent the new variant? Aguna Odobe, you don't add your name, but you're texting from Aguna Odobe. That's a very interesting question, isn't it? How do you respond to someone asking such a question? So that great question. I'm sure a lot of people have that. I think it really comes down to, you've heard of the term booster. You've heard of us talk about, those of us in the scientific community, talk about this may be an yearly event. So as of right now, we haven't gone there yet. We are definitely thinking about it, and I wouldn't be surprised if that becomes the norm. But for now, no.
Okay. Well, let me go. We're going to go to Nigeria right now. Experts have expressed worry at the threat of the Delta variant spreading and causing havoc in the West African sub-region. In Liberia, we understand that hospitals are full and the country is relying on Cote d'Ivoire for supply of oxygen. We are connecting with Betty Johnson Mbayo. She's a journalist from Nigeria, Liberia, so we can understand the situation there. Betty, sincere apologies for keeping you on for a while. What are you dealing with in Liberia?
So, let me say thank you. It is mine, and I am totally glad to be with you. And it is sad as a journalist to see citizens day by day, and they are being pronounced dead, specifically after you've know them. And I can say that this reminds us about Ebola, because it is totally sad. We are dealing with it, and it's a reminder that we have not really learned from our Ebola crisis.
Let's get to a bit of specifics, if you have that information about how your health facilities are dealing with this. I mean, Liberia has been trying to build, the country back for some time now, and I assume that you've been doing very well with it. But now you talk about Ebola. Now we're talking about COVID-19. Now we're talking about the Indian strain. Do you have an idea how difficult it is for your health facilities to deal with it? As we understand, there is a shortage of oxygen.
Sure, yes. There's a shortage of oxygen. Of recent, the Indian representative to Liberia donated few oxygen, and it was meant to post, but then our health facilities are overstretched, and you find out that doctors and nurses are working beyond the stipulated time, and at the same time you find out that as a result, people are dying from usual illnesses because there are no beds within health facilities. So there has been a consistent outcry from citizens concerning medical facilities and denying them on grounds that there are no beds to accept those that have been ill. So
that
yes,
can be a very difficult,
our facilities are overstretched.
Yeah, that can be a very difficult situation to deal with. Betty, I just wanted to find out before we wrap up about restrictions. What sort of restrictions have been imposed in Liberia? I mean, there are a lot of Liberians who live here in Ghana. We know that Liberians travel around a lot as well. Have there been any restrictions imposed in the country?
Oh yes, of last week, the Ministry of Health and partners disclosed a new revised on health measures, and at that they decided to stop people coming from India, from Bangladesh, and this as a result is not really the issue that we are complaining about.
Okay.
What we are complaining about is if you go at a COVID area and you decide to be tested, the delay of you having your test is an issue. Can you imagine that you will have signs or symptoms of being ill, and then you go at this testing facility that the government recognized, and when you go there, you are told that within 3 days, you're going to get your result. Our thing is not about those who are coming in. What we are saying is that there should be immediate test. At the same time, if your test is done, the results should be given to you. I mean, there's no need for someone to be tested and you allow them to go home, and after 3 days, before someone have the result. That's totally unfair.
Because in 3 days, it's also unfair because in 3 days, this person could have been spreading to several others who would be spreading, and then it goes on and on. Finally, Betty, are there vaccines? Has Liberia started vaccination?
And time, we also do not have a kind of postal service in Liberia.
Hello, Betty, can you hear me?
Say again?
Yes, I was asking about vaccinations.
Yes, yes.
Has the country started vaccination?
So yes, earlier of this year, we received 96,000 doses of the AstraZeneca vaccine, and our inquiry as journalists is that we were told that the vaccine should have been expired in April of this year, and the health authorities are mute on if the vaccine that have been administered, if it is expired or not. So yes, there are vaccination, but then the sincerity comes in. Citizens are asking why the president and his wife and other public officials are not taking the cues to go and take their vaccine. Because if they do take their vaccine, it's going to raise some hopes that this vaccine is of help if you have COVID.
So if I understand what you're saying, Betty, sorry to interrupt you. Sorry to interrupt you, Betty, but if I understand what you're saying clearly, the president or the state officials have not taken the jabs themselves, and so people are very reluctant, or people are hesitant to take the vaccine.
Majority of them, yes.
And there is an expiry date attached to the vaccine. That's what you're saying.
Yes.
Right.
Yes. Yes, that's the fact.
Betty, I thank you very much. I thank you very much for your patience and for your time explaining what the situation is in Liberia for us. That's Betty Johnson Mbayo. She's a journalist in Liberia. Doc, I'll take your thought quickly on Liberia, and then I want you to wrap up with us on how Ghana can prepare from your perspective towards a third wave, because we've been told to expect it.
Correct. just listening to the journalists that you just spoke with, yeah, it makes you realize the difference between some of these countries. And as a nation, Ghana, I think we have to, I always say that we should always be positive and look at the glass as half full. And from that perspective, yes, there's a difference. Clearly, we're doing a lot more better compared to Liberia. I think specifically on what we can do, there's nothing that any country can do to stop it. It will happen. It's a matter of what level do you get it and what sort of preparation you put in place. And so the key is really being able to keep up there. You shouldn't have patients coming in, getting tested and going home for example, 3, 4, 5 days, assuming that before they get the results back. Antigen testing is great. Having the PCR before you board the flight is awesome. And then here, what we can do really is just continue the genomic sequencing even within the community, ensuring that you have the capacity. If patients get sick and people get sick, you want to be able to isolate these patients in hospitals, in isolation centers, where you can truly try to decrease the sort of infectivity rate. Otherwise, it's going to be a problem and you're going to have, unfortunately, a lot of lives lost. And so those are the things we should keep in mind.
Let me just read a few of your messages from our viewers. And Betty, I'm sure that you've heard what the doctor we have here in studio has said. Maybe the message can be spread, and I really sincerely hope that there will be some kind of help with the situation in Liberia. This one says, I want to make a humble submission, Gifty. Please, I guess the government must be strict with the adherence of the protocols. I guess it's about time the government revises the measures to keep us on our toes. Kofi Abochi sent this message from Ga East. This one says, our health authorities in Ghana, says, is government still charging $150 for COVID-19 antigen rapid tests? They're taking $50 at the moment at the Kotoka International Airport. Samuel, health authorities in Ghana to be trusted. Samuel sent this message from Germany. Samuel, thank you very much for your message as well. And someone is asking about where you get your jobs. At the moment, I don't think there is any vaccination going on here in Ghana at the moment, so I'm not sure. Ama sent that message from Wager. Ama, thank you very much. And finally, this one says, so far, the providence of the Most High has kept Ghana and Africa from the predictions of doom over our continent. I believe we should continue doing our best. However, no matter the variant that emerges, the God of heaven will preserve us. Or Kojo send that from Kaswa. Doc, let's take your final message and then we go on. We wrap up.
I think my message to Ghanaians is very simple and clear. The reality is the simple fact that everyone is tired of having to wear masks and sticking to these protocols. But I always try to drive home the point that those of us in the healthcare sector who are basically witnessing these severities and illnesses due to COVID-19, I think we need to continue to preach the message. I was humbled by the number of deaths that I saw in the ICU. And that I always try to tell people, don't take this disease for granted. It can affect you. It's definitely affecting people. And yes, it is hard to wear masks in the middle of all the heat that we do get from time to time. And sometimes even if you need to take a mask break, do it. Take a mask break, but put it on. I think that is the one thing I can tell you, and be assured that government is doing whatever they can to really help. But we also need to do our part whilst we put the pressure on government to help us survive.
Right. Thank you very much. And just as we were about to go, I got this message that says, very informative. Doctor, thank you to the doctor. This is Anderson from Techman. So, Doc, this listener has just thanked you for us. Thank you very much once again. Dr. Samuel Kojo Amwakohene is an anesthesiologist, a COVID-19 ICU team leader at ACHN Health Network Connecticut, a co-founder and president of Global Partnerships, Halodyne LLC. This is still The Pulse with me, Gifty and Apia. Let's go for a very quick break. We'll be right back. When we come back, we'll talk about how children are feeling so hopeless that they feel like getting out of this country is the best option. Not just that, some of them are actually contemplating suicide. That should worry you. We'll talk about that when we return. Do stay with us. Welcome back to the show. Many thanks for staying with us. Now, studies conducted by the Center for Social Environmental Research at the University of Ghana says hopelessness is pushing a lot of teenagers in the country to contemplate suicide. The development is said to be more worrying in the senior high and tertiary institutions. We have more on this disturbing issue shortly, but closely related to that is a study published by Child Rights International, and it found that about 55% of children in Ghana believe that the future is bleak and they are planning to leave the country by 2040, citing jobs, education, and better standards of living elsewhere as their reasons. The survey focused on expectations of some 11,288 children between the ages of 12 and 17 in all 16 regions of Ghana. According to the report, 94% of the children say they are worried about getting a job in the next 2 decades. My colleague Elton Brobe has been studying the findings, now reports.
The research conducted from June 2020 to April 2021 targeted children between the ages of 12 to 17 and aimed at providing evidence on the values and issues of concern to children and further provide them with the needed opportunity to have their voices heard on key issues that affected them. The findings adapt Ghana through the lenses of children present and the next 20 years. The research was to gauge and explore children's life experiences on issues affecting them now and how the country might be in the next 20 years. The findings says children are worried about getting jobs in the future, with majority of them predicting that unemployment would make it harder for some citizens to make ends meet than they did now. 71% of the respondents revealed they would focus their attention on solving the unemployment problem in the country by creating jobs if they became leaders in the future. The findings showed that 35% of the respondents said acquiring technical or vocational skills through technical vocational education and training TVET will be essential for them to be employable in the next 20 years. But more staggering is the finding that 55% of the children said they wished to migrate definitely, whilst 11% said they would either stay in the country or leave eventually, even though a majority of them said they were proud to be Ghanaians.
Elton Brobe there, who has been looking at the report. Well, Judith Awoche Tando has also been interacting with some teenagers at the Accra Academy Senior High School. Hear them.
Do you think that there will be enough job opportunities for you when you are done with school, or you'd rather, like the 55%, want to travel abroad? So can you tell me your name and your age as well and what you think?
Okay, my name is Penyo Hudson Adu. I am 18 years old. Okay. And personally speaking, I would like to travel abroad because here in Ghana, there are not a lot of industries. So when we complete school, we will not get like enough jobs because there's going to be pressure on the few industries we have here. Yeah.
Okay. So what as well do you think?
Please, my name is Emmanuel Free. I'm 18. So I think that after school, due to high population in the school, like there will not be enough jobs for us, and the way our economy is also affect us. So I think traveling abroad will be better.
And what about you?
Okay, I'm also your boy Dean, and I also think the same as my friend here. Traveling abroad is the best option. So with our population, as we were saying, as the population rate is increasing, job opportunities decreases as well. So traveling abroad is the best option. Yeah, but I love my home, so I'll live in Ghana and work here.
So who wants to actually live in Ghana? I mean, okay, you want to live in Ghana, yeah. So you don't think traveling abroad would be your option? Who else wants to live in Ghana? So what do you want to do then?
Well, okay, I won't say maybe traveling abroad is the best thing to do.
But what would be your option?
Well, if I get a chance, I'll go, but if I don't, I'll stay in Ghana. Because if we all can't decide to go outside the country and work. Because you have to have people here to help the country, also improve and work.
So I believe that, yes, we all have to have the urge to work for your country. But looking at the reality of things, the unemployment rate, even as at now, do you really think that there will be enough job opportunity for you when you're done with school?
No, there won't be enough.
And what do you think as well?
I also think the same as my brother here, because even when you look at our senior brothers, and they are struggling with their jobs, and even if they can't find jobs, how much more we who are behind? So I don't think it's the best option for us at the moment. So when we get an opportunity, we might just go outside and then just further our lives there.
Okay. And lastly, what about you? Give us your opinion.
I'm Mr. Dennis, and I want to seek greener pastures outside, because in this country the resources here are less, and looking at our population, we all can't get job here. So I need to seek greener pastures, and the job opportunity or the career I want to offer is not here. I can't get the job here, so I need to seek greener pastures abroad.
So you had some of the young people there. Well, for the Center for Social and Environmental Studies at the University of Ghana, the level of depression and hopelessness among some teenagers is alarming. Joining us is the Executive Director of Child Rights International, Bright Appiah, who is joining us via Zoom. Hello, Bright. Right, hi, good afternoon. I do hear you now. Yes, I do hear you. Let me also introduce my next guest, who is a clinical psychologist, Dr. Emmanuel Sampong. Doc, thank you for your time and good afternoon.
Good afternoon.
Well, Doc, I'd like to start with you because Child Rights International did one of the surveys. So let me bring you in now and to hear your thoughts on the young people we have just been speaking to and those who were spoken to in the Child Rights International survey, what they said. Now, part of them wants to seek greener pastures. They believe that is the best option for their lives to move out of Ghana. Some of them are being driven to contemplate suicide at this age. What do you make of this from a psychologist's perspective? Hello, Doc. Okay. Looks like I'm having a bit of an issue with Dr. Emmanuel Sampong there. Let me bring you in, Bright. Bright, so what, 11,000 plus children have been answering your questions, and it looks like 55% of those think that life outside Ghana is better by all means. Did they give any reasons why they think the way they do?
Well, children listed a number of issues before even coming to the reason why they feel they want.
Could you please say that? Could you please say that again? I think I lost you at the beginning. I didn't really get what you said.
Yeah, I'm saying that children listed a number of things as reasons why they want to leave this country, and even before that, they did assessment of the current social problem that we have in this country. And they listed unemployment as an issue, social weakness in the social safety net also as an issue, the poor education. So clearly they are sending a signal that these are not things they want to see. For that matter, they scan through other areas and they feel that when they go there, they would get these things. Well, so they have expressed that yes, the majority of them said they are going out for greener pastures. The second option that came, that children said, was that they want to go there to further their education. And then also others also want to have a better standard of living. So these are the reasons that children give that they want to leave the country.
And I'm wondering, what you have dealt with children, for many years now. What do you think they see or it's influencing their thought processes that's making them think that what they think they don't have here, they are much likely to find elsewhere?
Well, you see, if when your colleague interviewed one of the students, he made mention of the fact that even the brothers are not getting job to do, how much more after school. So it means that there are certain things that we've done in the past that are communicating to children to have the belief or not to have the belief that this thing is good or it is bad. So for that matter, they are also taking decisions as a result of that. They look at the family system, whether life is okay, and if life is not okay, what is contributing to that. You go to an environment where the children are very intelligent, but accessing a scholarship is an issue for them. Then
generally their siblings, junior siblings, would also begin to pick some of these characters and all that. So what pertains in the environment is what is communicated to the children, that if all things not being equal, they will find the option outside. And we all know that we sometimes also paint a very good picture about other countries than us. So they pick some of these signals. They think that, okay, if that is how those countries are, then probably going there to seek for greener pastures will be an option for me. So these are some of the things that goes on that children attribute to saying that if they get the opportunity, they will leave the country.
I was really hoping that we could get Dr. Emmanuel Sample so that we get, okay, let me try him again. Dr. Sample, are you there?
Sure, I'm here.
Great, great. So I wanted to take your thoughts. Did you hear the young people on their reasons? Yes.
Right. So I was going to say that, yes, from where I'm coming from, yes, I believe in research. And for that reason, I need to commend Child Rights International for, that important study. And it's actually bringing out very key issues that we need to ponder over. So essentially, what they did yielded, some quantitative figures. And what your reporter also went out there to do was more like, adding on the qualitative bit about it. And that's the most important part. The children providing explanations and reasons why they would want to leave. And for me, I think that we have all the time thought that, yes, because they are children, they possibly may not have any option. But perhaps this study should open our eyes to begin to take these children serious, because if this is what they are thinking, trust me, at the end of the day, we will have quite a number of them who will want to follow through, the thoughts that they are providing now. And if we tend to lose these people, some of who will end up, having the kind of skill that we will require as a country to be able to develop, and we happen to lose them to other countries, then I think that it's about time that we began to be serious and take what they are saying very seriously.
Taking them seriously and being serious. And Bright, let me bring you in again. I was wondering, do you think social media, or too much exposure to social media, maybe accounting for some of these thought processes? Not that I think the children don't have a mind of their own, but perhaps social media just sort of magnifies the way they see things and the way they see difference in their lives and the life that they see on the other side.
Well, we have not done any research in that area to see how social media is influencing some of the decisions. But what I can say is that we have undermined the intelligence of children for a while now. So we feel that there are certain things that they may not have understanding of it. But this particular research has revealed a lot of things that children are thinking very deep, to the extent that they're even thinking of what their future is going to be like. And that is a space that we have taken for granted. And I feel that for now, moving forward, we should engage the minds of our young people through any form of policies that we want to enact, so that we invite their views and see how best we can shape those kind of things. And I believe that if children are given information, there are two information that children can give to you. Either they are well informed about the decision or the information they're providing, or it's an ill-given information. So whichever way they present it, it should afford us the opportunity to explain to them that this is the way to go. This is the thinking pattern that you need to establish. But now, these are the thinking patterns of our children in this country. So if we still continue to assume that they are still young, they can't think for themselves and all that, then we have to revise our note very well so that we can engage them in the process. But if yes, there are areas, so for instance, there are areas like national pride, where children are saying that social media accounted for some of the things that they described as the open space for democracy and all that. Because about 28% of the children are saying that, because when they go on social media, they see people posting all kinds of things, and the authorities do not come for those people. So therefore, they feel that Ghana is a very democratic state. And that is negative, but because we have opened that avenue, children, and then the free will of people to do whatever they want to do, say whatever they want to say, children rather attribute that to the kind of democracy that we are practicing. For that matter, they feel that once people can express themselves, then it means that democracy is contributing to the free will of people and all that. So these are things that we have to pay and then see how some of these things are influencing and shaping the minds of our children.
My final question to both of you, I start with Dr. Emmanuel Asampong again, is the way forward. You've talked about taking them seriously now. What can we do from families with this information that we now have? What will be your advice as to what can be done to change their mindset if we should?
Right. So for me, this is a wake-up call for us, and I mean, these findings should actually inform the kind of policies that we begin to develop, or if you like, those that are there. If there are avenues of bringing in, some kind of changes, we need to do that and factor in whatever we do the views of these children, because I keep saying that they are the future leaders, and if we do not, listen to them in respect of how they want to see the future, so we can carefully plan, something that they expect to meet, then we'll be making a lot of mistakes. Those days where we said that children were only to be seen and not to be heard, I'm sure are gone. And so this is the time we need to not only see the children, but we also need to hear them.
To hear them more. Let me end with you, Bright. Hearing them more, how effectively can we do this? Your thoughts as we wrap up.
I think we should communicate with our children, both at the family level, and anytime that they are introducing policy, we should engage them. When we do that, we can give them a well-informed, we can give them a position that is well-informed, so that when they are taking decisions, they will know which decision they should take.
Right, thank you very much as well. Bright Appiah, the Chief Executive for Child Rights International, they did that survey, and also had Dr. Emmanuel Asampong, who is a psychologist. Gentlemen, thank you so much. And hopefully we get better and change the mindset of our young ones here in Ghana with our own behavior as adults also. Now, this afternoon, questions are being raised about government's basis for a decision to terminate a power purchase agreement with GPGC. This has resulted in a $170 million judgment debt. The power agreement was signed in June 2015 by the NDC administration at the height of the power crisis, Christine Dumso. The new patriotic party, shortly after forming government in 2017, served notice of plans to terminate the power agreement that had resulted in the state incurring cost of energy it did not use. Well, this quest has landed the state into a $170 million judgment debt, with the arbitrator ruling that the basis of the decision to terminate the agreement did not reflect the true facts. There is more in this report.
The year 2015 will be one in which we banish darkness from our land and put an end to doom so forever.
Government, as part of its efforts to deal with the power crisis, entered into a power agreement with the GPGC. The company was to relocate its power equipment from Italy to Ghana to improve power supply. Following a change in government in January 2017, the Volta River Authority informed GPGC that it had decided not to proceed with the leasing of its land on which the equipment was to be placed. In April 2017, a committee set up by the Ministry of Energy asked in its report that government consider termination of the agreement at an estimated cost of $18 million rather than the payment of an excess capacity charge of $24.9 million per year over the contract period of 4 years. In August 2017, Attorney General Gloria Akuffo described as illegal construction activities undertaken by GPGC because the company had failed to obtain a license from the Energy Commission. GPGC proceeded to drag government to arbitration. The arbitrator found that government had simply taken a decision to terminate the agreement and was seeking to identify a legal basis to achieve this. The claims of illegality were described as false and not reflecting the true facts. It therefore awarded GPGC a total of $170 million in respect of its early termination payment claim. Attorney General Godfred Dame says he will task the Criminal Investigations Department to investigate former NDC government officials for what he says is their role in incurring the debt.
I'm going to write a formal complaint requesting an inquiry by the CID. The entry into this transaction was what resulted in financial loss to the state.
But former Deputy Power Minister John Jinapor insists the AG's office did not put up a good defense and should have negotiated with GPGC rather than seek to terminate the agreement.
Why did you ask the minister to terminate and to say that we're not paying a penny? And yet even the committee's recommendation that negotiate and pay 18 million, you did not do that.
Well, we've been engaging the Attorney General and the former Deputy Power Minister on this. We'll take a very quick break. When we come back, you'll hear what necessary actions they want taken and what their defense has been. Welcome back once again. I want to take you quickly to Parliament, where the National Security Minister, Albert Kandapa, says former Ashanti Regional Security Liaison Officer, DCOP, retired Ayensu Opare-Addo, was removed from office by men from headquarters because he was obstructing the work of his successor. Responding to questions in Parliament, Mr. Kandapa explained that DCOP Opare-Addo's 2-year contract was cancelled midway by the National Security Coordinator, but he refused to leave office. Listen. Sincere apologies there. We're trying to connect with Joseph Opoku-Gakpo live from Parliament so we can hear from the National Security Minister, Albert Kandapa. Well, listen to him now.
Was given a 2-year contract to serve as the Ashanti Regional Security Liaison Officer after the expiration of an initial 2-year contract, which began on January 5th, 2018. His new appointment, Mr. Speaker, took effect from January 1, 2020 and was to expire on December 31st, 2022. However, his appointment was terminated on February 19, 2021 by the National Security Coordinator. Upon the termination of his contract, Mr. Speaker, DCOP Opare-Addo was paid his entitlements as per his appointment letter. Subsequent to the termination of the appointment of DCOP Opare-Addo, the ministry appointed Colonel Francis Dufa Atta, retired, as the new Ashanti Regional Security Liaison Officer. The Colonel's appointment took effect from 1st May 2021. But Mr. Speaker, DCOP Opare-Addo refused to hand over to Colonel Francis Dufa Atta. DCOP Opare-Addo then declined numerous invitations from the National Security Coordinator to explain his refusal to vacate the office.
We'll bring you more of that subsequently, but Joseph is joining me live from Parliament. Joseph, so this explanation given by the National Security Minister, did this satisfy the expectation of the person who filed the question?
Roxanne Dafiamekpo, who is the MP for South Dai, was the one who asked this particular question. He had a lot of follow-up questions to this response that the minister gave, trying to probe whether it's actually appropriate practice to move into an office space and kind of use force to get out anyone. To which the minister responded and insisted that even if he has the opportunity to do what was done in terms of getting DCOP Opare-Addo out of the office again, he was virtually going to go the same way. So the minority MPs really weren't very much excited with the responses that he gave. So,
Joseph, we need to wrap this up quickly, but I'm assuming that he's not the only one who has been responding to the minister's response.
There were other probing questions from the MP for Adaklu, Kwame Agboja, as well as a number of the minority MPs. Also the Ketu South MP, Ablaji Fagomashi, and essentially they were trying to point out to the minister that they found a problem with the use of armed men in terms of them moving all the way to the Ashanti region to try resolve the issues, rather than him using his office as the Minister for National Security to deal with the issue. So there was, for example, a question from Madam Gomashi to the minister about whether when he communicated, or for that matter, the National Security Coordinator communicated to Mr. Prayado the termination of his contract, there was a response from him, which he replied and said that nothing like that came. And they virtually made the point that some other measures could have been used to resolve the issues amicably, rather than having armed men get to his office in Kumasi.
Joseph, that is a story that will continue subsequently here on the channel. Thank you so much for those details. Joseph Opoku Gakpo is Parliamentary Affairs Correspondent. He joined us live from Parliament. And this is where we say bye-bye for today, but let's talk showbiz is how we wrap the whole show up. Do stay and have fun with it, but there is more news at myjoyonline.com. Parliament to pass stringent law to fight activities of LGBTQI+, according to the Speaker. That and some other stories you can find there on the My Joy Online platform. My name is Gifty Ando Apia. Many thanks for your time. Do stay for Let's Talk Showbiz.